Alright, welcome class. So welcome to Abnormal Psychology. As you may have read in my profile, I actually went to school to be a therapist. So this is actually a treat for me to be able to actually teach abnormal psychology. I no longer practice as a therapist. I am dedicating my life to teaching and hopefully teaching the future therapist of America. So let's dive into the beginning of this class where we're going to cover different disorders throughout the class, talk about the treatments for those disorders, how do we know or how do we diagnose an individual with this disorder. You're going to actually participate in, I'm going to give you case studies and you're going to read the case study, identify the symptoms and the criteria, and then diagnose the individual. And then you will also provide a treatment plan, some type of treatment that you're going to apply to the individual, which we will talk about in the next video. We'll actually scratch that. We'll actually talk about that throughout the whole course. And also a prognosis. And a prognosis is kind of a educated guess as to what their future looks like, okay, with this disorder. What is their future with this disorder, okay? But let's dive in first to what is abnormal psychology, right? Abnormal psychology, and there are a few different other subtopics or subcategories that fall under abnormal psychology, such as psychopharmacology, which is basically talking about drugs. And it goes by different names, okay? But we're going to focus on just abnormal psychology. So what is abnormal psychology? It is a field of study that is looking to predict, it is looking to explain, and it's looking to change abnormal behavior. But then that brings up the question of, what is abnormal behavior? And who gets to define what is abnormal? Well, the way that we actually diagnose or how we understand abnormal behavior comes from this very large book here, okay? This is called the DSM. It's the Diagnostic and Statistical Manual for Mental Disorders, okay? This is the 5th edition, which is the newest edition. It came out in 2014, I believe, okay? This is what clinicians, therapists, will use to diagnose. Inside is going to be criteria. Okay, so inside it's categorized based on different disorders. Let's see if I can get to a page here. So this is the start of bipolar and related disorders. And then if we flip the page, you will see all of the criteria that will fit for bipolar 1, bipolar 2, and we'll get into these when we talk about mood disorders, okay? So when a therapist has a client, they will record the symptoms that the client is expressing to them, the client is talking to them about, okay? It's very important that you understand that when we are diagnosing a client, or when you're using your case studies, okay, you have to diagnose based on the information that is provided to you. Okay, we have to remove assumptions, we have to remove biases, we have to remove, if they're having this, then they're also probably having this. But if they're not really telling us and we didn't ask the questions necessary to get that information, we have to diagnose on what we see. Not what we think, not what we assume. We have to diagnose on the symptoms that they are telling us and what we see in the therapy room. So when you're doing your case studies, you can only diagnose based on the information that is provided. No assumptions. Okay? So who defines abnormal behavior? A big group, a huge group of therapists and psychologists and doctors, all that stuff. They're the ones who put this together. They're the ones who look at society, they look at what's happening in society, and they look at what's called the 4 Ds. Okay? And what they're looking for is they're looking for behavior that is deviant, behavior that is distressing, behavior that is dysfunctional to the individual or their relationships, and behavior that is dangerous. Okay? So, deviance, what that is describing is behavior that does not conform or go along with societal expectations. It is behavior that deviates from what society expects. Okay? When we think about something such as homosexuality, okay? Years ago, not even that far long ago, okay? This book and the people who created it, previous edition, not this edition, but a previous edition, included homosexuality as a psychological disorder because it deviated from the social norms. It deviated from society at the time. Hence, I said at the time, because it has changed many times. And currently, we are seeing a larger acceptance of homosexual behaviors, right? We're not, it's becoming less and less deviant to society, and there is a larger acceptance, a larger understanding of that behavior, and so it is no longer in this book. Okay? So, distressing. Is the behavior that is happening distressing to the individual? When we talk about mood disorders and we talk about major depressive disorder, okay, we're familiar with the term depression, but major depressive disorder. When an individual is experiencing major depressive disorder, it is distressing to them. When they cannot get out of bed that day because they just don't have the energy or the motivation or the desire because they are experiencing a depression of their mood, a depression of their energy, that is distressing to them. So if that behavior is distressing, then there's a good chance it's going to end up in this book, right? All right, and then dysfunctional, okay? So dysfunctional is describing behavior that pretty much like if the person is out of line with themselves, right? It's creating a dysfunction within themselves, and it's creating a dysfunction within their life, okay? So something such as schizophrenia, okay? So schizophrenia is creating a dysfunction, right? The individual is having difficulty functioning within their life. They're having difficulty with, maintaining a job or finding living and so on and so on, okay? So it's creating this dysfunction, right? Versus a function, okay? So they're finding it difficult to actually function in life. That dysfunction, right? That behavior that becomes dysfunctional for them, there's a good chance that may end up in the book, right? In the DSM. And then danger. So is the behavior dangerous to themselves? Is the behavior dangerous to the people around them? Okay, and if it is, then there's a chance that that may end up in the DSM-5. So when we look at abnormal behavior, the biggest thing we're looking at are these 4 Ds: deviance, distress, dysfunction, and danger. Is the behavior, does the behavior fit into these 4 Ds? And if it does, then there's a good chance that there may be something else going on that maybe treatment can help this individual in some way. Okay? Because that's what abnormal psychology is looking at. They're trying to identify the abnormal behaviors so that then we can actually begin to treat them. Okay? So treatment or therapy. So a lot of the treatment we're going to talk about in this class is going to be focused on psychotherapy, talk therapy. Okay? There is the biological therapy, which is medication, which we will talk about. I will give you some ideas about that. But understand that as a therapist, we are not able to prescribe medication. A psychiatrist who goes to medical school, they will end up getting a license where they can actually prescribe medication. Now, a psychiatrist can practice psychotherapy. They can, legally. but they do not have the education that a psychologist would have, or even a marriage and family therapist would have. A marriage family therapist and a psychologist, they actually learn the theories of psychotherapy. They learn how to actually perform talk therapy. A psychiatrist doesn't necessarily learn that skill. They're more focused on medicine, which is why a lot of psychiatrists now have backed away from talk therapy and only focus on providing medication, right? So they come in, they do an assessment, and then they provide medication. And a good psychiatrist will give a referral for a therapist or a psychologist. The difference between a therapist and a psychologist is going to be education. A psychologist has what's called a PsyD, which is basically a PhD. And then a therapist often just has not just, but because it takes a lot of work, but a therapist often has a master's degree. Okay? So it's really the amount of time and education that's put into their career is where the difference lies. So a psychologist typically takes 7 to 8 years, all right, to become a therapist. To become a therapist, it can be 6 years. Psychiatrist, is actually probably like 9 years. Let's see, it's about 8 to 9 years. Okay, about 9 years for a psychologist, and roughly about 6 years for a therapist. That includes bachelor's degree, right, and then the master's degree. Okay? So let's talk about therapy and treatment. So therapy is specifically designed to actually create a change in behavior. It is designed to create a change in behavior, okay, in order to help the individual to live and function in a better, more effective way. Okay? It is not necessarily designed to just eradicate what's happening, because that's very challenging. This is one of the reasons why a lot of people have a challenge when they go to therapy, is because it doesn't just get rid of it. Okay? You know, like if you get like an infection and you take antibiotics, the infection goes away. The antibiotics worked. Unfortunately, that's not how this works. Okay? It's designed to change behavior, okay, and it's designed to help the individual experience a more functional and effective life. But unfortunately, it doesn't just completely get rid of the behaviors. It can reduce the behaviors, and the behaviors can change to where they're not the majority anymore, but there's a chance that those behaviors may still be lingering from time to time, and it's up to the client, right, and it's up to the therapist to help the client build the skills to be able to actually keep those behaviors at bay. Now, for some individuals, it does require medicine to help, all right, as well as therapy. So that's often a very good treatment plan for some individuals, let's say like schizophrenia. Medicine to help keep the delusions and hallucinations at bay. Therapy to help them learn to be more productive and more effective in life, right, to create more function. Okay? Now, when there is therapy, we have to understand that therapy does require a beginning, a middle, and an end. There is an end to psychotherapy, right? And a good therapist understands that there is a beginning, there is a middle, and there is an end. The middle is the meat of the therapy. The beginning is getting to know the client, creating an alliance with the client, where the client's like, this therapist is going to help me. I can see that. The middle is teaching or providing insights for the client so that the client starts to change or modify what's happening, right? And then the end is we've gone as far as we can together. So now it is time to end the therapy with each other so that you can go out into your life, okay? Or into their life. You know, for me, I like to tell clients at the beginning, I would tell them, look, I see my job as to help you become your therapist. That's what I would tell my clients. And when I see that you have become your own personal therapist and you are helping yourself, that's when I know it's time to end. Okay? So, one of the things though about therapy and psychotherapy is there's a huge stigma. And a stigma is a negative perception or a negative belief about something. Okay? So there's a huge stigma towards therapy, towards psychotherapy. I've heard all kinds of things. I've heard people say things like, oh, those who go to therapy are just weak-minded. They just can't handle their life. But that is such a stereotype. Okay? And that's where stigmas often come. That's such a stereotype to think that therapy is only for the weak-minded. Or I've heard people say, well, therapy is for like crazies. I'm not crazy. But no, that's not entirely true. And unfortunately, the history, which you'll learn through your textbook, does kind of provide that stigma. And then media kind of pushes a little bit of that as well. If you've ever seen the movie One Who Flew Over the Cuckoo's Nest, all right, with Jack Nicholson, it's an old movie, but it's a great movie about the institutionalized era of abnormal psychology, okay? We don't do that stuff anymore. Well, actually, it still occurs, just not at the rates that it used to. We've been able to see that through psychotherapy and with the introduction of like medications, like people can live effective, functional lives where these behaviors are not distressing to them or they're not a danger to themselves anymore. So there's a very strong stigma, right? There's a public stigma, all right, that comes from society at large itself. There's also like personal stigmas, such as like label avoiding, right? Many individuals don't want to go to therapy because they don't want to be labeled. They don't want to be told that they are something and then they have to live with that diagnosis, right? They don't want to do that, so they avoid going to therapy. Self-stigmas, where the person just has a negative belief about it within themselves, like they grew up believing it, they still believe it, or they went to therapy one time and they were like, this isn't going to work for me, or this therapist isn't good for me, and then they were like, I tried it, we're done. Or courtesy stigma, which is basically, and the book talks about this, it's about like not going to treatment or therapy out of courtesy for the people around them, right? Which can be very problematic. All of these can be problematic if the individual needs help. Okay? And back to my statement about how people say like, therapy's for the weak-minded. If you've ever been to therapy, it takes strength to do the work. It takes a strong mind, or at least the openness to develop a strong mind in order to have that strength and those skills to do the work to modify one's behavior. It is not for the weak-minded, okay? It is for individuals who are looking for a way to have a more effective, functional life. And it can be as small as just, hey, things are getting hard for me lately, and I'm going through a lot, and I just want to talk to somebody, and maybe they can help me change some of my thoughts that I've been having. Something as small as that, right? Which is actually a majority of the people that you work with, or the people that therapists work with, right? It's not just for the crazies, right? Because that's one of the label avoiding ideas is, I don't want to be labeled a crazy, is what people will say. No. Even for people who are just going through an adjustment in life and they need a little assistance and they need to like learn some skills, because let's be honest, our families don't exactly teach us good skills, like not many parents are going to sit down with their kids and go, all right, let me teach you the skill of how to challenge your own thoughts so that you don't think negatively about yourself. What? Like, let's be honest, like those skills just don't really happen. And they may happen later in life as people move through life, but how great would it be if the person who's having trouble with, let's say, negative self-talk, they can go see someone who has these skills that can teach them the skills, and then they don't have the negative self-talk as much, and they know how to combat it now. And so when it does come up, they're able to counter it, and then they feel better. I mean, that sounds good to me, right? So, and we're, just so you know, therapists and psychologists and even psychiatrists, they're all working right now to try to remove the stigma of psychotherapy and treatment for mental health disorders. They're trying very hard. And unfortunately, there's a lot of barriers to all this because these stigmas are so strong, but they are trying very hard to actually work towards creating or getting rid of the negative stigma. Okay? So how do we counter this stigma? Well, some of the ways that they're doing it is education. Like me talking to you now and this course, and as you go through this course, you will learn. If you have a stigma about psychotherapy at this point, you will start to see, or at least you will start to feel that I'm chipping away at it, and you're starting to see, like, yeah, there's nothing for me to there's no reason for me to have this stigma towards this, right? So educating people, presenting therapy as it's treatable, like the disorders are treatable. We can help these people, right? We can help people who are experiencing some type of mental disorder. We can. It is treatable. And there is recovery. The individual can recover, or at least helping, providing hope to the clients and the patients that come in that recovery is possible. Okay? So, that is Abnormal Psychology. All right? Please, if you have any questions, email me or message me through Canvas. Feel free to post in what's called the muddy topic discussion that I have available. That's really for you and your classmates and peers to actually communicate with each other. I will stop by every now and again to just see if I can answer any questions or provide some clarity, but really that's for you and your classmates to discuss. So the muddy point discussion is for you and your classmates to discuss. But if you need to get a hold of me immediately, please email me, or the fastest way is actually through Canvas messaging. All right? So I'm looking forward to having you in this class. So have a great week.